Imagine arriving at your 65th birthday, filled with excitement for this new chapter, travel, time with family, pursuing passions, and then realizing the healthcare maze called Medicare is something you must navigate right now. What if I told you that most retirees are paying hundreds, sometimes thousands more than necessary, just because they didn't know how Medicare really works? What if I also told you that with the right knowledge, you could make decisions that save you money, reduce your stress, and give you coverage that matches exactly what you need? Not more, not less. If you're retiring soon or already enjoying retired life, this video is for you. Why Medicare matters. First things first, why should Medicare be something you really care about? Because when you retire, your employer's health insurance typically stops. Many retirees overlook that Medicare becomes your primary health insurance. If you miss sign-up windows, there are penalties, forever. Healthcare costs after 65 can spiral fast without the right coverage. So Medicare isn't just insurance for old folks, it's a safety net. And just like choosing your first home, you want the foundation to be strong. The basics. What is Medicare? Let's break it down piece by piece. Foundations first. Medicare is a federal health insurance program for anyone 65 or older, some younger people with disabilities, those with end-stage renal disease, dialysis or transplant, or ALS. And Medicare has four main parts. Think of them like layers of an onion. 1. Hospital coverage. Covers inpatient hospital stays, skilled nursing facility care, some home health care, hospice. Most folks don't pay a premium for Part A if they or their spouse paid Medicare taxes for at least 10 years. But there is a deductible for each hospital stay, and coinsurance if you stay longer than a certain number of days. 2. Medical insurance. Covers doctor visits, outpatient care, preventive services, durable medical equipment. Monthly premium, standard. May be higher if your income is above certain thresholds. Has a yearly deductible and typically a 20% coinsurance after you meet it. 3. Medicare Advantage, Part C. An alternative to original Medicare, Parts A plus B, provided by private insurers approved by Medicare, often includes additional benefits: vision, hearing, dental, sometimes gym memberships, sometimes lower premiums, sometimes lower out-of-pocket maximums. But network restrictions, referral requirements, and different rules for out-of-network care. 4. Prescription drug coverage. Adds coverage for medications, administered by private insurers. Has two major parts: monthly premium plus cost sharing, copays, or coinsurance. Also includes something called the donut hole. Yes, sounds weird, but it's a coverage gap you need to understand. Supplement. Medigap. If you go with original Medicare. Medigap is an optional supplement plan to cover out-of-pocket expenses like deductibles, coinsurance, and copayments. Sold by private companies, standardized in many states, so Plan G, Plan N, etc. mean the same thing in each participating insurer. Costs vary by plan, region, age, tobacco use, but they can be worth it to avoid surprise medical bills. Important timing: when to enroll. This is one of those things where timing really is everything. Initial enrollment period, IEP. 7 months, 3 months before you turn 65, the month of, and 3 months after. If you miss that, you'll likely pay a late enrollment penalty that lasts as long as you have Medicare. There's also a general enrollment period, January 1st to March 31st each year, if you didn't sign up when first eligible, and special enrollment periods for people who delay because of employer coverage or other qualifying reasons. Don't wait until the last minute. A little planning ahead can spare late fees and a lot of stress. Prescription drug coverage, deep dive. Drugs can be one of the most confusing, most expensive corners of Medicare, but also one of the most essential. Here's what to look out for. Formulary. The list of drugs covered by the plan. Just because a drug works for someone else doesn't mean it's covered in your plan. Tiers: generic, brand name, specialty drugs. Prices increase as you move up tiers. Coverage gap / the donut hole. After total drug costs reach a certain threshold, there's a gap. You pay more of the drug cost until you reach exit point. Plans are filling this in more, but cost is still higher in the gap. Catastrophic coverage. Once you spend a lot out of pocket, even more help kicks in later in the year. Penalties for late enrollment. If you don't have creditable drug coverage, i.e., at least as good as Medicare's minimum, when first eligible, you'll pay a penalty forever. Cost increases. Selecting a plan that matches your drugs, not someone else's, is key. It's surprising how many retirees end up with a plan where their prescriptions cost far more than they need. Preventive care and benefits you might not know. Here's where things get exciting. Medicare offers lots of benefits you may be missing. Annual wellness visits and many preventive screenings like mammograms, colonoscopies often come at no cost. Vaccines such as flu, pneumonia, COVID-19 covered. Free benefit for smoking cessation, depression screenings, obesity counseling. Many Advantage plans add extras: dental cleanings, hearing aids, vision exams, fitness memberships, even transportation to medical appointments. These extras can significantly impact quality of life, not just your budget, but how well you live during retirement. Why this matters beyond dollars and cents. I want you to feel inspired, not just overwhelmed by premiums and deductibles. Because Medicare can let you retire with peace. Peace knowing your health care is handled, not guessing whether a doctor visit will cost you a fortune. It can let you focus on living your best life. Travel, family, hobbies, not bills, paperwork. Did I sign up for the right thing? Anxiety. When you understand Medicare, it stops being a paperwork nightmare and becomes a tool, a way to secure the next chapter of your life. Here's what I want you to remember. Medicare isn't something to fear, it's something to master. You deserve a healthcare plan that works for you, not something you just accept because everyone else has it. So don't wait. Make Medicare work for you, not the other way around. If you liked this video, hit that subscribe button, give it a thumbs up, and share with friends or family members who are retiring or about to. Who knows? You might help someone avoid hundreds or thousands in medical bills they didn't need. Stay curious. Stay empowered. Your best chapter starts now.